Scott says he's just going to put one of those revolving doors at our front door instead of just the one that opens and shuts.
Yeah, saves on energy.
Actually, for a while when we had all of those, all of our extended family members, if you will, who were joining us at different times, it really would have been easier to have the revolving door between them and their friends and all of this. I thought, you know, there were times I thought, oh, just leave the door open.
Yep.
Mm. Good morning, Lindsay.
Good morning.
Did you have a good weekend?
I did. How about you?
Yeah, well, it was wonderful that it wasn't today, right? Yes, we did. We had a good one.
All right. I do see Betsy, Lindsay, Jim. Ted usually calls in, so let's see.
Yeah, I'm here.
Yeah, he's on.
Oh, okay. Good morning, Ted.
How you doing, Stan?
We're doing well, thank you. Let's see, who else do we have? Carol?
Yep, that's all I have on right now.
Carol's here.
And Phil is out there somewhere and muted in no video land. So it looks like we have a quorum.
Okay, Phil. Yep.
I am
think so.
actually here.
All right, good. Good morning, Phil. All right, let's go ahead and get started. It is 8:32 on Tuesday morning, the 8th. This is the meeting of the Legislative and Human Resources Committee of the Kent County Board of Commissioners. And to begin, yes, you are there. Good morning, Wayman. Will you go ahead and introduce us to our method of meeting?
Yes, pursuant to Governor Whitmer's Executive Order 2020-154, the Legislative and Human Resources Committee of the Kent County Board of Commissioners today, in order to protect the public health, will conduct this meeting via electronic communications. Any member of the public wishing to listen to the proceedings or provide public comment may do so using the following internet connection or phone numbers and passcode. It's also posted on the agenda that's in front of you. You may call you may email public comment at kentcountymi.gov. Anyone disrupting the meeting by using offensive language or actions may be removed from the meeting.
All right, thank you. Let's go ahead and start with the agenda. The first item is the public comment. If anyone from the public is participating in this meeting, you may address the committee in one of the methods that Wayman just indicated. Please identify yourself and you have up to 3 minutes on 80 items that are on our agenda. Is there anyone from the public on, Pam?
I don't see anybody with hands raised, and I don't see any messages currently in the inbox.
Okay. We'll move slowly to the next item in case anyone is still gearing up the energy to talk. All right, if not, let's move to the next item, which is approval of the minutes. Is there a motion to approve the minutes from August 11, 2020?
Melton moves.
Supported?
Support by Hennessy.
Okay, moved by Commissioner Melton, supported by Commissioner Hennessy. Any discussion on the minutes? I see no hands up. So all those in favor, well, I'm sorry, we have to do this by roll call.
Yep.
Yes, that's fine.
Okay.
Commissioner Hennessy,
Yes.
Commissioner Kallman, Commissioner Melton,
Yes.
Commissioner Ponstein, Commissioner Teal,
Yes.
Commissioner Skaggs,
Yes.
Commissioner Talon,
Yes.
Commissioner Vonk,
Yes.
Chair Steck,
Yes.
And that motion passes.
All right, the minutes are approved. Let's move to item number 3. I see Adam London is online. Good morning, Adam.
Good morning.
Thank you for joining us. He is here to present the Health Department performance measure review. You have access to the
I
screen
do.
share.
I'm pulling up my slides at this moment. Do you see them now?
I do.
Okay. Good morning, everyone. These are our 2019 Health Department performance measures. 2019 seems like an awful long time to us at the Health Department right now. And so the first thing I want to mention is that we had every intention of doing a new strategic plan fully in line with the Board of Commission's strategic plan and beginning that at the beginning of 2020. However, the world and fate had other plans for us in 2020. And so we have not been able to do a new and revised strategic plan for the Health Department. So what we have here are measurements from our previous strat plan. And so you'll see that in some cases there are some transition and some irregularities as we're working with updating objectives from 5 or 6 years ago. And as we do, I'm going to go through our alignment with those board priorities that you established last year. Some of the strategic goals that I think are we're most fitting to talk about today from the measures that we do have. Keeping in mind that I think I've got 6 or 7 different measures to talk about here, some of which show some areas that we need to improve, some of which show some things that we're doing that are quite extraordinary. But they're just a small sample of what the department does, of course. I often say that the Health Department does everything from animal adoption to zoonotic disease and everything in between. And so feel free to ask questions about programs that aren't mentioned in these measures. And then those performance metrics, some significant accomplishments from 2019, and a look ahead to what we're looking forward to in 2021. And as I do this, I'll be mentioning where our objectives align with those priorities that the board set forth last year of economic prosperity, high quality of life, excellence in service delivery, inclusive participation, and effective communications. And I think overall the Health Department's area of prioritization falls in line with those middle priorities, the high quality of life. Of course, with our focus being on public safety and wellness, excellence in service delivery, and inclusive participation, working well with the community. Our mission at the Health Department is to serve, protect, and promote a healthy community for all. And I often think that the most important 2 words in that are the first word and the last word, serve all. And so you'll see that theme in the 4 goals that we have presented here. Those 4 goals, one of each relates to each of the divisions that we have at the Kent County Health Department. Our administration division is to serve, protect, and promote a healthy community for all by providing overall leadership and support to the department. This is the division which includes our epidemiology team, our communications team, finance. It includes grants and planning. It also includes myself, Teresa Branson, my deputy, and Dr. Nurali Bora, our medical director at the Health Department. Goal 2 is in our community clinical services area, where their overall goal is to serve, protect, and promote by preventing, detecting, and treatment of illness and disease. And this is the division where you'll find our immunizations program, our STI program, tuberculosis program, some of our additional vaccine programs like travel vaccines, which we're one of the few providers of the yellow fever vaccine, which is very useful and in demand for people who are doing travel and especially missions work to some remote places in the world. Our WIC program, the supplemental nutrition program, is also in the clinical services area of the Health Department. Our goal 3 area is in community wellness. And these are the programs that work to bring public service to the community. And so we're looking at our Strong Beginnings program, Nurse Family Partnership program, our health education programs, those programs that are generally sending nurses, dietitians, social workers, community outreach workers into the community. And then environmental health, which is working to serve, protect, and promote by preventing injury and illness from exposure to environmental hazards. And here's where our food safety program, our drinking water quality programs, campgrounds, pools, the animal shelter is located in environmental health, which animal control is also important for not just for animal welfare, but also for preventing injury and illness to our human population. And then a special note that in 2019, one of our big wins was adding a 5th division late in the year called Community Health Strategy. And this is the division that was built in response to our community health needs assessing that we've done in partnership with the healthcare systems for the past 9 years, where we've identified these big wicked problems in the community. Things like poor mental health, high rates of suicide, substance use, opioid overdose, obesity, the sorts of challenges that no department, no institution can solve by themselves. So we built this collaboration that is facilitated through our Community Health Strategy division, which really works on bringing the community together to work on some of these big challenging problems. First metric I want to share is from our administration division, and it's advancing health and all policies by providing at least 5 learning labs and sharing with partner organizations in 2019. And we did that by creating a toolkit based on health and all policies, which is a framework of understanding how policy is informed by health considerations and public health considerations. We did create a toolkit. You can find it on accesskent.com. We hosted 5 learning labs with participants from a number of our larger employers here in the community, especially in the healthcare fields. We also engaged in sharing this information with external partners. We shared it with the National Association of City and County Health Officials, who were very impressed by it, and they've used that to share across the country some of the tools that we've developed. We also presented that toolkit to the State of Michigan's Public Health Advisory Council, which is a council that has been in service to advise the governor for, I think, 4 or 5 years now. Rick Snyder created it, and Gretchen Whitmer has continued it. And also a presentation to our peers at the Michigan Premier Public Health Conference in October of last year. These toolkits are now being used by many of our peer counties around the state and around the country. The next is a bit of a wart on our department, and I want to share a couple of these as we go along. Our goal here is that 95% of our communicable disease reports are completed within 30 days of notice of that instance of disease. And this is actually a requirement that the state has of us as well. And this means that as physicians report communicable disease to the health department, we investigate, and we are doing that in a timely way, but we have to do a write-up of that investigation within 30 days. Those write-ups are important because they help the state and the counties in our region understand what's happening from a communicable disease standpoint in our area. We have fallen short of that 95% for most of the past 5 or 6 years, actually. Our past 2 accreditation cycles have dinged us a bit on this. To correct that, this may sound familiar to you because just within the last couple of weeks, you have approved the appropriation of additional funds from the state of Michigan for essential local public health services. And one of the positions that we created was a public health nurse that's going to help with disease investigation and reporting so that we can get these reports done in a much more timely way. I'm hoping that when we report the 2021 numbers that we're very close to 100% with these investigation reports. The next metric is immunizations, and having at least 71% of our children, the toddlers, 19 to 35 months of age, being fully immunized. And that's based on the Michigan Community Immunization Registry data. And you'll see from the bar graph that this does not look too good. And I'm not sure if it's much worse or much better than how it looks. There's a couple things to understand here. And one is that in 2019, the definition of what fully immunized means changed because the Hep B vaccine was included in the schedule of vaccines that the toddlers are getting now. So that 63% does not actually mean that Kent County was worse off than we were in 2018. It simply means the definition of what it means to meet that became much more challenging. However, overall, our vaccination coverage situation may actually be this bad or worse based on COVID-19 and the reality that for the past 6 months, vaccine appointments have dropped off, not just with the health department, but with providers throughout the region. And so that's something we're all very concerned about in public health, is that we've got some work to do to make up what's been lost in our coverage rate over the past 5 or 6 months. So that's something that we're going to be working very hard on going forward. We need to keep that vaccine coverage as high as possible, especially for things like measles, which are incredibly contagious and can be devastating to the health of children. And so it would really be a shame if we were to lose herd immunity with some of those more contagious infectious diseases.
Adam?
Yes.
Sorry, it's Betsy Melton. Can I just interject, or Stan, would you prefer we waited to the end? Chair Steck, would you prefer I waited?
Sorry, it's me. Let's wait till the end.
Okay.
And let Adam get through this. I suspect we all have some other questions. Thank you.
The next metric is enacting the recommendations of a lead task force. And this has been a priority for all of us for a couple of years now, as we've recognized that that our community, and especially certain zip codes in our community, have some of the highest rates of lead poisoning in the state. I think the lead task force, which this board conducted a couple of years ago, did tremendous work, established a number of really powerful recommendations. And we did a great deal last year to put those recommendations into action, including hiring and training and certifying 3 employees to conduct lead inspections. They were certified in late 19 and began their work at that time. They're now full speed doing that work. And then expand our communications and health education through the Don't Play Around campaign. And this was an area that the task force learned that many people, especially in our most vulnerable communities, did not realize many of the very simple things that can be done to protect their children from lead exposure. And so we believe then, and still believe, that health education is one of the most important keys to reducing the rate of lead-borne poisoning in Kent County. And you can find those materials at don'tplayaround.org. There's some great videos that were produced. Some of them were put on the air locally. We're still using those materials and the checklist and the risk assessment on that form to share with the community. And that's been very, very powerful as well. Unfortunately, the lead action team, I'll talk about that in a little bit, we had hoped to have moved much more powerfully behind that in 2020. Work has been done, but not nearly as much as we would have liked because of COVID-19. The animal shelter, and this is one of those examples of an objective from our old strategic plan. But I've left the number in here because I think it's illustrative of the work that's happened in the last 5 or 6 years. The objective here is that 40% of the animals received by the animal shelter will be adopted or reclaimed or transferred to partner agencies. At that time, I think we are looking at what we call a live release rate. The animals that are reclaimed, adopted, transferred at being in the 30% range. And over the course of the last 5 or 6 years, because of great work by our staff at the animal shelter and great work in collaboration with partner organizations here in Kent County, we've moved that number in an extraordinary way, where in 2019, over 76% of the animals received by the animal shelter were released alive. So far in this year, we're trending over 80%. So when we do our next strategic plan, I suspect we'll have a number 85 or 90% of the animals received walking out our doors. So just really proud of this number, and I think it speaks volumes to the work that many people have done in the community to show that these animals are great animals, and we can do better for them, and that's been happening. A couple of measures from our environmental health team. Customer service is really important here in making sure that we're getting our restaurants inspected according to their required frequency. Most restaurants are inspected twice a year. We always make sure that those inspections happen within 30 days of their 6-month due date. And our well and septic evaluations, the permit creation, the inspection of those systems when a transfer of property happens, the entire process we want completed within 30 days. The initial service we want done in 10 business days, but the whole paperwork and everything should be completed within 30 for both of these service areas. Both of which are evidence-based and correlate to better public health outcomes in the community. Food safety and drinking water quality are both very high priorities for public health, along with wastewater management. And certainly, as we've seen over the past handful of years, these are things in which our community is vulnerable. Our drinking water quality and the quality of our groundwater reserves are very important to not just the public health of Kent County, but the development and the economic prosperity of Kent County. We have seen in these areas that we have fallen short a little bit of our goal for where we would like for our turnaround to be. And again, this may sound familiar to you as well, because we have added positions here in the past several weeks that we'll be looking to fill based on the additional resources that we received from the state. So we're hiring some more sanitarians to add to the workforce. Our work demand continues to grow in these areas. Restaurants, the number of them continues to grow. Even in the midst of the COVID pandemic, we're seeing the number of establishments hold steady. And that reminds us of what happened with the Great Recession a decade ago, where many jobs and many businesses were lost in other sectors, but the food industry seems to hold its own pretty well. And even as businesses go out of business, it seems like there's always another entrepreneur looking to move into that physical facility. So we do see that restaurants tend to do pretty well, especially in our region. In our well and septic evaluations, there again, we're seeing, we saw a slowdown for a little bit with real estate transfers and with new startups. Those things seem to be heating up again now. I know our sanitarians are very busy at this moment, permitting new wells, new septic, and repairing ones that have failed because of old age or other damage. Some significant accomplishments I want to talk about for a moment. The first is the North Kent Exposure Assessment that was done in 2019. For the first half of that year, we were hosting clinics at the health department pretty much every other weekend for about 5 or 6 months. I think we did about 12 of those clinics where we were inviting people who had been affected by the PFAS exposure area in and around Belmont and Plainfield and Algoma townships to come to us. This was a project done in partnership with the state of Michigan, where we were trying to see what the exposure to PFAS correlated to in relation to actual concentrations of those compounds in their blood. And so I think it was about 400 people were assessed during those clinics. We have a report that the state is finalizing right now. We're actually going to have a webinar next week, the 14th. The state of Michigan, in partnership with myself and my department, are going to be sharing some of those initial findings with the community and sharing the report with them as well. So I think that was a win. It was a win for the people in that area who early on told us that they were mad that this happened to them to begin with, but they were very adamant that if there were lessons that could be learned, that could be shared with other communities around the country about what PFAS is and what it does to a community, that they wanted us to aggressively pursue every opportunity to learn those lessons. And so this exposure assessment was part of that learning. There's going to be another assessment that the state is going to be leading to better understand the health consequences over time. And so we'll be learning more about that and sharing that with the community as well. Eastern equine encephalitis response. Again, it seems like a long time ago, but last fall, if you remember, we were also talking about Friday night football and mosquitoes and a strange exotic virus. That was the Eastern equine encephalitis virus. We lost a number of horses and a lot of deer to that last year. Thankfully, we did not lose any Kent County residents to EEE last year. Many of our neighboring counties to the south in the Battle Creek, Kalamazoo area did lose people and had many severe illnesses because of it. It's something we're watching very closely this year as well. So far, there have been 13 horses, to my knowledge, that have died of EEE in the northern Kent, Montcalm, Newaygo County area. We are increasing our communication on that. These late summer, early fall mosquitoes tend to be the most troubling for us, both because they're the mosquitoes that spread EEE. They also tend to be the mosquitoes that spread West Nile virus. So this is a very important time of the year to avoid mosquitoes and to be aware of the threat that they present. The Opioid Task Force, very proud of the work that they continue to do in 2019. We saw the high watermark, I hope, in 2016 with the number of opioid deaths that we had in Kent County. The numbers have trended downward since then. And part of the reason for that, I believe, has been the great work of the Opioid Task Force. And this is a task force that, in addition to health department staff, includes leaders from our healthcare systems, from law enforcement, from nonprofits, from schools, from local pharmacies. It's really a powerful and impressive task force, and they have led changes and the availability of resources in the community that have been appreciated and I believe have made an impact in driving the opioid overdose numbers down. Decreasing infant mortality, and this is really important to me and to the team. And we've talked about this before, but just to reiterate, back in about 2003, our community was identified as having higher than normal rates of infant mortality. And in particular, the disparity that existed between the rates of infant mortality between white babies and babies of color was startling. And to give you some perspective on those numbers, for every 1,000 Black babies born in Kent County at that time, about 20 did not live to see their first birthday. For white babies, it was about 6. And for Hispanic babies, it was about 13 did not survive. 13 out of 1,000 did not survive to the first birthday. Through the good work of the county, of our healthcare systems, of law enforcement, we tackled this from a number of different perspectives. Everything from car seats to to sleeping education, to getting nurses and community health workers in the home. This community really rallied around this issue, and we've had some great success in that all of those rates, the 20, the 13, and the 6, each of them have been cut in about half over the course of the past 17 years. Now, we did some math on that, and when we looked at the birth rate over those years and the reductions in the infant mortality rate that happened over those years, we estimate there's almost 200 children that are with us now in Kent County that wouldn't have been if we had done nothing. And that's really, we're super proud of that. I think all of you should be as well, that there are 4 or 5 bus loads full of kids that are with us today that wouldn't have been. And making Kent County a place that is welcoming and warm for new moms and babies is something that's very important to us. Something else is very important to us that I think we're making some progress on is the Behavioral Health Crisis System Project. This is a project that began from a number of areas. It began from the work of the Community Health Needs Assessment, which identified mental health and poor mental health as the community's #1 priority. It also originated from the work of Network 180, and Commissioner Steck, you were part of this with leading their project to look at the need for a crisis center in this community. We have now moved that need to what we've called the Kent County Population Health Consortium, which is a partnership of the executives of our healthcare systems in this community, including Spectrum, Mercy Metro, but also Mary Free Bed, Pine Rest, Hope Network, Network 180, Forest View Hospital. It's co-chaired by Wayman, along with Mike Jannernoa, who have taken this project on, this need to improve the system of mental health crisis care in Kent County to the next level. And from the top down, Wayman and Mike and all of those executives of those organizations have said, it's not just good enough that we have a crisis center. It's important to us that we have a world-class system of crisis care and prevention in Kent County, that Kent County is looked at as a leader in this area that other areas can model from. That work has proceeded. There is a report that is nearing completion that has identified priorities such as creating this crisis center, creating mobile care units, creating a call center, and making sure that this is a system that accepts everyone, regardless of their ability to pay, where the first question that's asked when someone calls for help or walks through the door isn't what insurance do you have, but is how can we help you? And that's very important for everyone involved in that project. And the lead action team framework. And while I wish we had more work done at this time on bringing that to life, we did create the framework for creating our lead action team. And it's important to us that we take the lead task force work that was done a couple of years ago and we turn that into action now. And so the county, in partnership with the City of Grand Rapids and others, is looking at and has created a framework, a strategic plan for addressing lead improvements in the community and reporting back to the community on a quarterly basis. We rolled this out in mid-February, and we had really hoped to have some wins to report over the summer, but again, unfortunately, COVID-19 happened, and many of the people who would have been working on this lead action team have been doing contact tracing and testing and those things. However, now that we're kind of catching our breath, we brought in lots of additional helps for COVID-19. We're starting to push people back into these projects, and so I hope certainly by the time I give this presentation next year that we have those wins to talk about with lead action. And looking forward, just a couple things I want to share as we look forward into the early part of 21. COVID-19 continues to be a priority for us. The testing, the contact tracing, the communications work. It's all been a tremendous amount of work for everyone, not just in the health department, but in administration, and all of the other departments of the county have really rallied together and have made so much possible over the course of the past 6 months. But now it's important for us to continue those things, however, to transition into a vaccination plan. We are doing that. We're bringing in labs and others to help with the testing work. Our big strategy here is we want to move our resources from testing to vaccination as vaccine becomes available. And that's why it's important that we have these partnerships with NextGen Laboratory and some of the other laboratories that we've been working with. And then communicating and continuing the work of health equity. And this has been a priority for us for a long time, recognizing the disparities that exist in our community and so many of the areas of public health, and making sure that we're living up to that potential of a healthy community for all, and that we're empowering people with what they need to be successful in their lives, and making sure that we're bringing forward our services in a way that is truly helpful for the community. And they had a role in planning. And this is important for us as we think about vaccination, for instance, because for many of us, we've looked at the data and we know that that communities of color are most vulnerable to COVID-19 for a lot of reasons, none of which are genetic, but for a lot of reasons because of housing and because of work demands and other stresses. And so it would, in many instances, be our ideal to roll out vaccine in a way that is immediately accessible to those most vulnerable communities. And we want to do that. However, we also need to be very mindful of the reality that many of those communities have been traumatized over the course of history by government, and by we want to avoid any appearance of trying to roll in a new vaccine into a community without making sure that they have a role in planning how that happens, and that that they know that we're not trying to use them as a guinea pig, for instance, for whether or not something works, but that that we deeply respect everyone in our community, and it needs to be everyone's plan. So I'll stop there. I know that's just a snapshot, a taste of what the health department is doing, and I can certainly entertain any questions you have.
Thank you, Adam. I expect that there will be a number of questions from the committee members, so I'll open that up at this point to committee members if you have any questions or comments for Adam. Yes, and sorry, Betsy, you were probably the first because you raised that earlier on. So Commissioner Melton.
And actually, it was good that I waited. I have a couple now, but the first is when you were talking about vaccines, and it just kind of word on the street, if you will, listening to people. I am a bit concerned, and I'm guessing that it's made its way to your ears also, the number of families who are choosing to not vaccinate at all. And for a while there, it seemed to be in this state or in that state, but we're seeing it more in West Michigan. Are there tools that you might share with persons who might not? I mean, I have some of that background, and at least a little bit, sometimes a little bit is a problem, but enough to share as to why this is a good thing. But I know that you have shared that at our board meetings before the CHOC meetings. Some talking points. I think you know what I'm trying to get at, because I do have a concern that my grandkids are going to be going to school with many who have not been vaccinated.
Yeah, it's a great concern that we all have, that we have seen that there is this growth in the anti-vaccine movement, and I think it's one of the drawbacks of social media in some ways, and that it has made it possible for those that have either misguided or other agendas to make some of this false and really poor science, to make it present and to undermine confidence in the vaccines, which are safe and which have been tested to extraordinary lengths. And certainly no product is 100% safe all the time. But when you look at the actual performance and the record of vaccines, the safety of vaccines is really impressive. And I think as a society, we've forgotten how awful polio and measles and pertussis and diphtheria and these other preventable diseases really are, and the massive suffering and toll they took on generations bygone. So I hope we don't learn those lessons again the hard way in the future. And yes, we do have talking points that I'm happy to share with all of you.
Okay, that would be good. Again, I hold my own pretty well most of the time, but I actually have an amazingly large group of women that I occasionally exercise with, and there's not a one of them that vaccinates their kids or grandkids. And I mean, my eyes raised almost out of my forehead when I learned that. Because I know that they go to school with, kids that will go to school with my grandkids. So thank you. And the only other thing that I have to add, Adam, I hope that you pat yourself on the back and your team on the back, that you have managed to put together all the things that you continue to do this year. And you remain faithful, you remain strong, you remain impartial, factual every week now. For a while there, it was every day, as I'm sure you are very well aware. And who ever knew when I first met you that you would become an or at least a national figure. Actually, my daughter in Australia listens to you, so I guess I can say international figure. But truly, you are a wonderful voice of reason. You hit some of the hard areas, but you do it well. You do it with dignity. You do it with knowledge. I know I have said this before, but I just have the utmost gratitude and respect for you and what your team is doing. And I won't list them all, but I hope they all know who I mean, because I'm on your board, and it is an honor to be on that board. So thank you.
Thank you, Commissioner. And you said it right with team. It's an amazing team, and I get way too much credit for the amazing work they do. But it's a team that includes all of you, includes Wayman administration. We've got a great Kent County team. So thank you.
Thank you, Commissioner Melton. Commissioner Hennessy.
Thank you. Adam, a lot of your services are really direct, one-on-one. And I'm curious as to, where things are and where you see them heading now, particularly with the WIC program, where we depend very much on that, individual enrollment, the contact, the helping with those problems as they, mothers encounter them in the early days. So where do we stand with WIC and that personal service?
Yeah, actually, I was very impressed with how seamlessly we moved WIC and our home visiting programs, which is a funny thing to say now, home visiting programs, because we moved them all to virtual pretty quick. And I just dread to think what would have happened if this sort of pandemic would have happened 10 or 20 years ago, because all of those services would have been lost. But the WIC program continued, the home visiting programs continued in a virtual way. And in fact, what I heard from our teams is that participation increased in those programs, both because demand was high for supplemental nutrition, but also during the stay-at-home orders, we had lots of young moms and expectant moms who didn't have, they were at home, and so they could take calls, where in the past, when they were working and going to school, they were more difficult to catch sometimes. Now, I think we're kind of in a tricky spot now as we transition to kind of a hybrid world, where many of them are going back to work and back to school, and we're kind of in a hybrid setup with our work. We're still doing a lot of it in a virtual way, but we're also doing some of it in the field in a safe but in-person way. So we're trying to do the best we can to roll with the punches and use the technology as best we can. But I don't think we've had people fall through the cracks because of how good the technology's been.
That's encouraging to hear. Thank you. Are we working, we have so much going on with Strong Beginnings, which works with Spectrum Health. Are we also working with St. Mary's and with Metro in terms of, how we're serving people? We have one contract, but does that extend to all of our hospitals and all of our moms, wherever they might be?
Yeah, it does. We work with the providers who are doing OBGYN work and who are doing pediatrics work throughout all of our systems to make sure that we're getting clients directed to our early maternity programs.
Okay, thank you.
Thank you, Commissioner Hennessy. Commissioner Talon.
Thank you, Chair Stack. Adam, I want to add my thanks to what Commissioner Melton already eloquently stated, and thank you for all the great work of the department. I know it's challenging times, and I almost hesitate to call this particular issue to your attention, but I think it does pick up significance when we think about the importance of housing to health, public health, mental health, and so on. And I've been hearing a bit from the home builders community saying that they're in a boom cycle right now because of low interest rates, and that means additional inspections for septic and sewer and so on, and water, and that they're experiencing some delays because of a software package they're saying that we've implemented recently. Wondered if you were aware of that, if that's being addressed, if you could comment on that.
That's a good question, and thanks for bringing it to my attention. It's the first that I've heard of the software concern, so I will look into that today. I know that we did see a sudden surge in demand for those services. And we did have some of our sanitarians helping with contact tracing and some of the COVID-related things. We've transitioned them back into the field in response to the surge in demand for their regular work. So I think that problem is getting under control, but if there is a challenge with the software, which has been in place for about a year now, I'll look into that today to find out what that might be.
Appreciate it. And perhaps just a suggestion to reach out to the home builders organization and get some feedback from them. I know we've worked with them in the past on this issue, and I think that's been a good collaborative relationship. So they may be able to offer some help. Appreciate your taking a look at it. Thanks.
Thank you.
Thank you, Commissioner Talon. Any other commissioners have their hands up? As you're thinking or not, let me just raise a couple of things as well, Adam. First of all, thank you for the work that you and Wayman and others have put in to take the lead on this crisis response issue. As you know, this is something that's important to me through some of the efforts that we've been working on for years now in the crisis center response issues. And we all know that this kind of program will have significant impacts, not just on our physical and behavioral health systems, but also on our law enforcement, criminal justice, housing. The effects of this just permeate throughout our community. So really do appreciate you taking that forward and moving us into making that a reality. And I think over the course of the next year is when we intend to see some actual systems implementations, and as that gets defined, I look forward to being able to get that done. So thank you for your work on that.
Well, thank you for yours.
So one of the things that that we had set as our legislative priorities in the past years has been to push for the standards in the PFAS area. And as we have now moved into an environment where it appears that there may be standards that are going to be implemented, how does that impact what we do at the county?
Yeah, so it's going to impact a couple of sites where during the investigation into the contamination in, for example, the Rockford area, where There were other areas that that maybe had PFAS present less than the advisory level of 70 parts per trillion, but higher than the new cleanup criteria that were created. And so the state is going to be working with us, and this is not a Kent-centric problem. This is around the state of Michigan, where there are a number of sites that they found in the past year where they had hits of PFAS less than 70 parts per trillion, but possibly higher than the new standard, which was just created. And so they're going to be going back to those areas, retesting homes to make sure that they don't have problems that haven't been fully documented yet. So they're going to be working with us and counties around the state to do that over the next year or two. And so there's going to be communication, there's going to be education to those communities. And we're going to learn as we go. If there are more problems, but I think it's really important that we understand where those are at, and especially as improvements are being made to infrastructure, that those improvements and plans are done in accordance with the groundwater quality.
Thank you for that. And then maybe one last question for you, or issue to address. And certainly I join my colleagues in acknowledging you and the department and the whole team in rising to the challenges of COVID-19 in our county. And we continue to see what appears to be positive trends in both the numbers and that it appears that we've consistently been able to manage the infection rates well within our capacities of our systems. And now we begin to talk a bit about vaccination. And I know that you've already undertaken some efforts to begin to plan for that. Can you just briefly talk about what the anticipated strategy is for the county if and when we do achieve a vaccination?
Yeah, so what we hope to employ is what we call the push strategy. And it's a strategy that was very effective for us back in 2009 with H1N1, where we employ our network of vaccine providers, the pharmacies, not just the physician's offices, but the pharmacies and so many others. And we're pushing vaccine through all of these providers so that there's nearly a no wrong door approach to vaccine. And that way we can also prevent giant mass gatherings in front of the health department in the midst of a pandemic, trying to get the solution to the pandemic. So that push strategy is going to be important for us. But what we still don't know are the actual handling dynamics and requirements of the vaccine. Some vaccines are very delicate and have very detailed temperature holding requirements. And it may be, depending on what vaccine is brought to us, that we can or can't use that full scope of vaccine providers in our network because of the hardware they have on hand for managing that temperature. So we're paying very close attention to that. But communication is going to be critically important, as has been previously discussed. There's a lot of vaccine hesitancy in the community. We expect that in order to get herd immunity for COVID-19, we're probably going to have about 2/3 of the population vaccinated. I read an article a week or two ago that said that 1/3 of the population has no intention of getting it because they don't have confidence in it. So that means that we have to get everyone that is confident or isn't hesitant about it to accept the vaccine. And that's going to be a challenge. And so I think that having a really good communications plan to go along with this is going to be important. And communicating to the public that this was not a rush job. It's not, does not have inordinate risk associated with it. And the risk of COVID itself is much greater than any risk associated with the vaccine. And I know that Lori Latham and Steve Kelso and others are looking at communications planning and how we're going to do that. We're also working with some of those communities that have been disenfranchised and have been abused in the past by new and experimental things, making sure that they have a voice in a strategy and a plan building as well. But we've got our hands full with strategy. And a lot of the questions we can't answer until we know exactly what the vaccine is.
Well, again, thank you for all the effort and work. If our community didn't know we had a health department before, they certainly know it now. So thank you for all your work. Any other questions, comments from committee members? Commissioner Skaggs, you can keep your seatbelt on if you want to ask questions too. All right, if no other questions. Thank you again, Adam, for your report, and thank you for all your work, and to your team. I see Teresa's on here as well. All right, let's move to the next item, which is item number 4 from KCCA. Wayman?
Yes, this is a request to the Board of Commissioners to approve the continuation of 1 full-time community services assistant position to distribute Kent County Community Action designated grant funds as authorized by the Administrator Controller in Resolution 326-2028. Per the resolution, the County Administrator Controller was authorized to establish positions related to COVID-19 without Board of Commissioner approval during the COVID-19 state of emergency, and the action requested meets all resolution standards. Kent County Community Action requests an additional full-time community service assistant to assist in the county's response to COVID-19. This position is focused on homelessness prevention, utility assistance, mortgage payment, and the purchase of personal products for the distribution of COVID-19 designated CSBG and ESG grants. The annual cost of salary and benefits for the position allocated 75% to the CSBG CARES Act and 25% to the ESG CV grants. The CSBG grant period is April 1, 2020 to September 30, 2022, and was approved by the board on 4/23/20. The ESG grant period is also ends on September 30th, 2022. This action item is an activity related to COVID-19.
Is there a motion?
Moved by Vonk.
Moved by Commissioner Vonk, support.
Support by Melton.
Supported by Commissioner Melton. I see Susan Cervantes is on the line. Do you want to add anything to that?
Good morning, everyone. The additional position will help us to distribute over $2 million in homeless prevention. And this is something that we've been doing already, but even in the last week, we've distributed about $100,000 last week, and we could really use the support of another position.
Any questions or comments from board committee members?
Chair, this is Jim.
Yes, Commissioner Tallon.
I just wanted to clarify a couple things. One is, some of the funding is for the position is CARES Act funding, but I just want to clarify, are there COVID CARES dollars that the county has allocated that are being distributed through this position, or is it primarily or only for the ESG dollars? That was the first question.
Actually, it's for the CSBG dollars and the ESG dollars.
So the county CARES funding is not actually attached to these positions. Is that the question, Commissioner Tallon?
Yeah, I just wanted to make sure which kind of buckets were going to be worked on by this position. And the second question is the one I've asked before is, how are these dollars being coordinated through the housing assessment program at Salvation Army?
All of the referrals for these dollars are being passed through for the homeless prevention through the HARA. And we're working with the Salvation Army to come up with a way that we can assist them with their eviction diversion program also.
So if I could follow up, just to clarify, the eviction prevention dollars are nothing's happening with them right now, or we're doing it on our own, or where's that at?
No, we've already spent about $200,000 since April on homeless prevention. We are actually the only agency right now that's open to do the homeless prevention. There's a couple of others in the line, but the ESG dollars from the city of Grand Rapids have not been allocated yet or awarded yet to the agencies. And so those funds are not out in the community. And the eviction diversion prevention funds, the EDP funds, had to wait for the courts to be open because they were only for eviction diversion. And to qualify, the family or the household had to have court summons. And so we have been operating full force since April with these funds.
I guess my question is whether we're also allocating those funds by referral from the HARA.
Yes, we are. We're
Okay.
only taking referrals from the HARA
Okay.
for the homeless prevention. For the utility assistance, we're operating our own wait list.
And so no coordination with other agencies on the utility assistance, or is there some?
The only other agency that's doing utility assistance right now is the Salvation Army, but because they're so inundated with the EDP funds, we're picking up the utilities right now.
I understand you're doing the work, but in terms of referrals and prioritization, is that, I guess I'm a little bit confused about why that wouldn't be coordinated in a kind of coordinated effort for prevention, utility assistance obviously being a significant way of preventing homelessness, and why that wouldn't be coordinated with Salvation Army. Are you saying they don't have the capacity to be able to make those referrals based on prioritization?
For the utility assistance, they do not have the capacity since they have, they've just hired people for their eviction diversion program, which is $2.8 million that they have to get out the door by December 30th. And so we are taking the lead, as we've always taken the lead, with the utility assistance. And we have priority, internal priority, first come, first serve, and to meet the eligibility of the utilities. We're just trying to help whomever we can.
Appreciate that. And just a comment from my perspective, and that's that first come, first serve, and help whoever we can isn't the most desirable way. And I recognize if there is capacity issues at Salvation Army, that's a problem. And I appreciate, I believe you mentioned that you are working with Salvation Army on those issues, but really want to strongly urge us to continue to look at prioritizing coordination and applying these resources based on prioritization from the HARA, because that's what we know is the most effective way to address homelessness. So appreciate responding to those questions and listening to that comment. Thank you.
Thank you, Commissioner Tellon. Anyone else? Commissioner Hennessy?
Yes, this is Carol, and I'm curious, are we seeing more cases starting through the court system in terms of eviction? And are those on your radar? And with this alphabet soup of funding that you do have, I assume this position only is existing as long as there is funding to support it.
To your first question, yes, we are seeing, well, we had seen some of the evictions one Thursday in the 63rd court. They had 79 appearances. And so we are working with the HARA, with the Salvation Army, to address the 79 people that came in that were eligible for the eviction diversion program. And then in the utilities, with the moratorium that has been resolved, and now we're seeing a lot more people. We are working on a grant with the City of Grand Rapids Water, which is a $1.3 million grant for arrearages for both wastewater and water in the household to prevent and prepare for any COVID-related issues. So we're in the middle of that one. And then we have the position that your second question will be sunsetted after the grants are spent.
Okay, I have a follow-up, and that is your Section 8 people, the federal government considers them to already have a subsidy, so they're not, you know, they don't qualify for more subsidies, as I understand it. But do we have other help locally, or what is being done to specifically help Section 8 people?
Well, our Housing Choice Voucher Program, which is formerly known as Section 8, the people that we have call in with our CSBG funds, we can assist with our CSBG funds, but those are the only funds that can assist any Housing Choice Voucher person. The other ones, you're right, they cannot be subsidized if they're already subsidized.
You defined for me CSBG, all these acronyms.
Oh, I'm sorry. That's Community Services Block Grant. That's our Community Action Grant.
From the state?
Well, it's a federal grant that's passed through the state.
Okay, thank you.
Mm-hmm.
Thank you, Commissioner Hennessy. Anyone else? We'll say that I do support this motion, and as Susan can attest, the governing board has continued to work with her to encourage staffing up to make sure that we are able to make maximum use of all of the funds that have been provided to us. So thank you for that, and thank you for your efforts. Any other questions? If not, Pam, are you going to do the roll on this?
Yes, yep,
Thank
I got
you.
it. Sure. Commissioner Hennessy,
Yes.
Commissioner Kallman, Commissioner Melton,
Yes?
Commissioner Ponstein, Commissioner Teal,
Yes.
Commissioner Skaggs,
Yes.
Commissioner Talon,
Yes.
Commissioner Vonk,
Yes.
Chair Steck.
Yes.
That motion passes.
Very good. Thank you all. Let's move to item number 5, a motion from the Health Department.
Yes, this is a request to approve the continuation of one temporary 0.6 full-time equivalent position to the Kent County Health Department as authorized by the County Administrator Controller in Resolution 326/2028. The resolution was authorized to establish positions related to COVID-19 without board approval during the COVID-19 state of emergency, and the action requested met all resolution standards. The Health Department requested an additional 0.6 FTE specialist position to assist in response to the COVID-19 pandemic specific to county's migrant population. Position utilizes COVID-19 designated funds and began June 29th of this year and will terminate in December 13, 2020. This position is focused on assisting the Director of Community Wellness to develop an outreach plan focused on testing for a COVID-19 baseline. It also provides education in English and Spanish for migrants and farmers, and establishing protocols and education related to common practices among migrants that create risk for infection. The annual cost of salary and benefits for the position is $107,000. 60% of the cost is allocated from the CARES Act funding, and 40% was previously budgeted from county administration through the general fund. The impact of the associated staffing changes is cost neutral to administration and the Kent County Health Department budgets. The CARES Act funding has a March 1, 2020 to December 30th, 2020 cycle. This action item is related to COVID-19.
Is there a motion to approve?
Allen moves.
Moved by Commissioner Talon. Is there support?
Support by Hennessy.
Supported by Commissioner Hennessy. Any questions or comments?
Yeah.
Yes, I'm sorry.
Yeah.
Yes, Commissioner
This is
Talon.
Jim. Sorry, couldn't find the hand raise quick enough. I just wanted to clarify that this position, it looks like, started back in March at the beginning of the funding eligibility. Is that correct?
The position actually started a few weeks ago. I'm not sure on the exact date, but the action requested related back to the 3/26/2028 resolution. That's the date that we're talking about. This is the CARES funding that was approved back at that time. The position was recently approved, probably a month and a half ago, when we received a request from the Health Department to supplant additional time from Matt Channing, who is our agricultural preservationist. We pulled him inside of the organization. He was instead of the contracted position. So this was as of a month and a half ago that we added this additional workload to that position to support the health department.
So it basically started at approximately the beginning of August and will go through the end of the year. Is that correct?
Correct.
Okay, thank you.
Adam London, you're on. Do you have anything else to add to this?
No, just that, Matthew's been a tremendous help to us. His relationship to the farmers has been tremendous. This work is really making sure that they have a plan and the resources they need to make sure they can keep their agricultural laborers safe, and they have isolation and quarantine plans and resources and all those materials in Spanish and English, so that they can keep the fruits and vegetables being harvested without having a labor issue. So he's done a great job, and we really appreciate his expertise helping us.
All right, any other questions from the committee members? I don't see any virtual or physical hands up. So Pam, will you go ahead and take the roll? I'm sorry, Commissioner Hennessy, you're...
Oh, no, I'm just waiting for
Okay.
the.
You're just waiting for the roll. All right, go ahead.
Okay. Commissioner Hennessy,
Yes.
Commissioner Kallman, Commissioner Melton,
Yes.
Commissioner Ponstein, Commissioner Teal,
Yes.
Commissioner Skaggs,
Yes.
Commissioner Talon,
Yes.
Commissioner Vonk,
Yes.
Chair Steck.
Yes.
And that motion passes.
Good. All right, let's move to the next item, which is miscellaneous. Do any of the committee members have a miscellaneous item to raise? I don't see any. I see Phil talking,
Chair.
but I assume he's not talking to us.
Commissioner
Vonk.
Vonk has a question.
Yeah.
Yes, thank you, Chair. This is not quite related to Legislative Committee, but just in general to the commissioners. The airport had 100 days of reserves as of last month, and that's following policy. As of this month, because of the CARES funding, we have 250 days of reserves, and we're looking forward to 300 plus days of reserves in the future. Some of this CARES money naturally will be spent down. 100 days of reserves doesn't seem like a lot when you're having the difficulties that we face at the airport with a 75% passenger decline. At the DPW, we've had a slight decline in that business over the last couple of years, and not knowing exactly what it is. But we do carry a 3 to 6 month reserve at the DPW. I bring this up is that it's been mentioned by the commissioners of the Legislative Committee that we're not always informed what's happened at finance and vice versa. And with the turnover of commissioners and a relatively large one that it could be, it seems like the more informed we are as commissioners, the better informed. And soon these commissioners will fill in the slots at the airport and will be filling slots at the DPW and so forth. So I was wondering if I'll let the executive committee think about it, but if we shouldn't take a 3-minute time and talk about what's happening at finance at the end of our legislative meeting, and maybe likewise at the finance talk about legislative for 3 minutes for a better informed board, rather than at the end of an hour-and-a-half full board meeting where everybody's in space after going through all the work that we cover at the full board meeting. So that's just an idea I put out there. Not everyone is as lucky as Commissioner Teal, where they have a coach and former commissioner and an airport board member that is in close proximity. So I just pass that out for the future as the board moves forward into a new year and new challenges. So thank you.
Thank you, Commissioner Bach. Some good thoughts. Well, I just assumed former Commissioner Korndike was always available by speed dial to everybody, but and then Commissioner Skaggs, I know you were talking. I didn't know if you were on mute, but if not.
What was that, Chair Stack?
I was wondering if you were on mute trying to raise a comment, and I missed it, but.
No comments.
Okay. Any other miscellaneous? If not, I will again remind the committee that our deadline for the applications for the open positions is September 30. So I think it is incumbent on all of us, particularly in this committee, to continue to encourage folks in the community to take a hard look at these positions, to consider them, and to follow up and get their applications in so that we have a good cadre of candidates to consider. So by the time we get to the next meeting, we'll be past that deadline, I believe, and so we'll be looking at setting our teams together for purposes of filling those. With that, there's nothing else, we will stand adjourned. I'm sorry, the next meeting is September 22. We won't have passed that deadline, so we'll have one more time to talk about that. With that, we are now adjourned.